I will call the meeting to order, and the first order of business is going to be House File 767, which was sent to this committee, but it has no fiscal note, so it should not have been sent to this committee. It's a policy bill related to Health and Human Services, Human Services long-term care. Is that correct? And so I would move that House File 767 be recommended to pass and general register
Rules.
and sent to rules. Mr. Morgan, do you have any comments?
It was a deadline mix-up, Mr. Chair, and I appreciate the committee's time, and I know you have much more pressing things to move on to.
Mr. Chair.
So, Representative Abler.
Well, it never should have come here in the first place. So it'll be kind of fun to hear the author talk about the content of the bill for a while, just to see, since he's all by himself there. Never mind, Mr. Chair. We should. That's a good motion.
You're right, Representative Abler. We have nothing else to do today. So. Representative Liebling.
Thanks, Mr. Chair. I just want to say I know that Representative Morgan is fully capable of doing that, but we're going to spare ourselves.
So any further questions for Representative Morgan? I don't see any. All those in favor of the motion to send this bill to the Rules Committee signify by saying aye. Aye. Opposed? So the bill is approved and sent to the Rules Committee. Thank you, Mr. Morgan, for your very concise presentation.
Thank you, Mr. Chair.
And, okay, do you want me to go down there? Yeah, okay.
Okay, members, we're going to ask Representative Huntley, when he sits down and gets comfortable, to move House File 1233, and it will be recommended to pass and to be re-referred to the Committee on Ways and Means. And just before we get started, you all have been handed a packet with a rubber band around it. And it's the A13-0408, and you have that before you. And so, Representative Huntley, would you move your bill, please?
Madam Chair, I would move that House File 1233 as amended be recommended to pass and be re-referred to the Committee on Ways and Means. And then, Madam Chair, I would like to move an amendment to the bill.
Yes, Representative Huntley. Again, members, you have the A13-0408, and Representative Huntley, is that the amendment you'd like to move?
Madam Chair, I would move the A13-0408 amendment, which is a delete everything amendment and gets the bill in the order in which we want it. And we'll discuss what's in the bill in a second or two after the amendment is hopefully adopted.
Madam Chair.
Wonderful. Representative Abler.
And this is a valid motion, but I just wanted to point out to members how long the title page is. The back page is like 1 2/3 pages long just for the title. So that's the kind of work we do here. So we'll discuss the rest of the bill later. We never discussed the title page. Thank you, Madam Chair.
Thank you, Representative Abler. Any other questions? Does everybody have the amendment? Representative Gruenhagen.
So these bill summaries of April 3rd for HF 23, all this other information we have there, is that worthless?
Debris.
Yeah, I would just set that aside. Representative Gruenhagen will be starting with a new document, and I'm sure some new pages will be coming forward in the next day.
So that whole pile is?
Yeah.
We have killed a lot of trees today and last week. So members, yes, I think to point out some of the information in there will be irrelevant because some of the portions of the governor's bill obviously are in here, but it will be too difficult for you to try to use that document to go back and forth.
So,
yeah.
Okay.
Representative Kwan.
Thank you, Madam Chair, and I would like to thank the author for the delete all is actually shorter
than the original bill, and I'd like that progress.
Wonderful. Any other questions? Seeing none, all those in favor of the A130408 delete all amendment signify by saying aye.
Aye.
Any opposed? Great. The delete all is now the bill in front of us. And Representative Huntley, would you like to speak to your bill, please?
Well, Madam Chairman, the main thing I'm going to do is have Doug Berg go through the spreadsheet and explain what's in here, what's different from the governor's bill. There are certainly many changes, and you all know that we had a target of $150 million in cuts. This bill meets that target by a combination of cuts plus some raising of revenue. It's very complicated, and last night was a typical night for our staff. I was home having dinner at 5:30 when I received a call from Lucy Morgan and Doug Berg about there was a problem with the bill, and we had to make some changes. And so Doug and Lucy were here most of the night getting these ready and getting them drafted. Took a lot of time. I'm absolutely amazed that we have them already. And so with that, I would love to, or like to turn it over. Actually, I'd love to turn it over to Doug Berg.
Thank you, Representative.
To present basically the spreadsheet so people can have a general idea of what's in the bill.
Thank you, Representative Huntley. And Mr. Berg, would you like to take it over and walk us through? And I believe you have handouts, members, long handouts that you can follow along.
Madam Chair and members, members should have a legal-sized document that is titled 2013 Session Budget Proposal Tracking, and the time and date on it should be today's date, 9:37 a.m. I don't know if that also went out to the audience or not, but it is posted on the House website as well. And the first page, the only thing I will draw your attention to is orienting you to the sheet. The House columns are the left-hand 6 columns, and then for comparison, the governor's supplemental numbers are in the center. As Representative Huntley noted, if you look on line 7 and over to the House numbers, you will see the 14-15 number shows a negative $150 million, and in the 16-17 number, it also shows a negative $150 million, showing that we hit our general fund target. There's other summary information there on page 1 and moving on to page 2, but I'm actually going to jump to the middle of page 2 where the initiatives start with Department of Human Services. I will say as a sort of a general matter on how the spreadsheet works that the House bill takes all of the ACA items of the governor and all of the savings items the governor had, as well as most or all of his mental health initiatives, and then I will try to kind of go relatively rapidly and note the differences. So if you see, starting on page 2, the Department of Human Services, we have the ACA changes there, the enrollment and eligibility in the pregnant women and children to 275% of federal poverty level. Moving on to the top of page 3, we took the governor's item for emergency medical assistance coverage for cancer and dialysis patients. There is an item that is appearing in all the spreadsheets in the House bills this year, which is a base adjustment for the agencies to cover administrative costs at the agencies. This has not been done since 2007, and is just meant to acknowledge that over the last number of years, agency costs have been pared down to an untenable level, and this provides a modest bump on their base. The item below that is the mental health pilot project at the Zumbro Clinic. The item below that is the fetal alcohol syndrome prevention outreach program through Olmsted County. The item below that is Representative Fisher's bill to reduce the...
We had wanted to go through the section and then come back for questions at the end of each section, Representative Kwong.
Madam Chair, this one where he said it's adding back for the agencies since '07, what sort of is it the same productivity as in '07, or is there any productivity calculation in there since this is pervasive across the entire agency bill?
Madam Chair, Representative Quam, the way this is calculated, and you'll see that it is in the general fund and the healthcare access and the state government special revenue fund, lottery fund, wherever the various parts are funded. The way this is calculated is a 1% increase in each year on the salary base for the unit which is listed. Okay.
Representative Portman.
Mr. Berg, as you go through it, if you could refer to line numbers as often as possible, because it's very hard to follow.
Thank you. That's helpful.
Madam Chair, Representative Portman, I will try to remember that. I was trying to move fast.
If you want to ask questions, please signal that you want to be, excuse me, that you'd like to be put on the list. I will write you down, but we would like to get through the section and then come back if we could. Otherwise, we'll never get through the section. So that's how I'm going to proceed forward. I will take your names, so just signal to the staff or to me, and we'll add you to the list. Mr. Berg.
Madam Chair, members, and again, I'm now on the bottom of page 3. Actually, I haven't renumbered the sheet, so a number of these lines don't have numbers at this point. But on page 3, the second to the last item, which is titled Congregate Living Rates Modified for Homes with Mental Health Certification, is actually Representative Fisher's bill, but many members were interested. This reduces the reduction that occurred 2 years ago in congregate care low needs assessment. There, I think, was a general acknowledgement that the low needs assessment did not handle mental health issues well, and this would reduce that cut for congregate situations where they receive mental health certification. The last item on page 3 and running on to page 4 is limiting the statutory managed care organization trend caps in statute. The statute for managed care organizations includes a list of percentage increases that can happen to the trend line, the cost trend line for managed care organizations over time. There's language that will reduce those percentages, which produces a savings against the future costs for managed care contracts. Again, on page 4, the second item is Representative Loeffler's bill that's dealing with medical assistance eligibility for inmates in county jails and at the State Department of Corrections. You'll see that item adds to 0. What is going to happen is the cost, the medical assistance cost of those inmates will be picked up at DHS, and then there will be an intergovernmental transfer from the Department of Corrections to DHS to cover the cost. So there's a net 0 at DHS. There will be savings, however, that accrue to both corrections and the counties.
Mr. Berg, Representative Huntley had a comment.
Just for the members, Madam Chair, you may remember right now people in the correction system are not eligible to be on medical assistance. Some of these people do get sent to a hospital because they need to be in a hospital. And while they're in the hospital, what this or this part of the bill does is make them eligible to be on medical assistance, which means that medical assistance pays for their hospitalization. The correction department does not directly. So in the original bill, that was a cost to Health and Human Services budget and a savings to the corrections department. And what this does, and one of the advantages to this, by the way, of course, the federal government pays 50% of the cost of their hospitalization. So what this does is transfer money from corrections to the Health and Human Services budget so that we don't get stuck with the cost of that. And we're saving corrections money and let them pay for it.
Amen.
And as long as we're at a stopping place, Representative Abler, did you want to comment on this particular provision, or would you like to?
No, I can wait.
Okay, thank you. And members, you've just handed out the House Research Bill summary, which may help you follow along a little easier. Mr. Berg.
Madam Chair, members, moving on again on page 4, The next item is titled Network for Better Futures. We heard a presentation from them and a bill. There is $200,000 in here, and it is my understanding that Representative Clark's bill will also have some additional funding for that. Moving on, the next item is a repeal of the increase to the Teen Challenge program that was put in place last year. The next item after that is a repeal of the MFIP family cap, which was, I believe, Representative Fritz's bill. Members will note that the MFIP family cap is being increased with TANF funds, and there were no TANF funds to spend, but in this case we're cutting the support services grants in TANF that deal with job counseling and using that money in the cash grant line to repeal the MFIP family cap. The next item is titled MA Dental Services Expanded. This is Representative Norton's bill to add back sedation services in and home visits for MA Dental for disabled individuals. The next item after that at the bottom of page 4 is the child care absent days. Representative Moran's bill, which returns the absent day number to 25 days. It was reduced to 10 days 2 years ago. At the bottom of page 4, we have two items that kind of parallel each other. Nursing homes, there is a 2% rate increase in the first year of the biennium, and there is below that a 2% increase for the home and community-based providers that were identified in Representative Newton's bill. Moving on to page 5 at the top. We have a change in critical access dental language. Actually, the title should be changed. It shouldn't have that Ann Merck on there. It's just critical access dental. This change would put in statute that only for a health network that has multiple clinics, only the clinics which have critical access patients that meet the threshold in statute would qualify for the payment, not all of their clinics because one would qualify, and this has a savings. The next item after that is the ICF-DD surcharge. This is actually a rate increase for ICF-DD providers. Because of the federal match on that, there is some savings to the state, but the providers get a bump in their rate, and my understanding is the ICF-DD providers favor this increase. Below that is an item titled Hospital Surcharge. Many members will remember this has come up before. The governor proposed it in 2011. This increases the surcharge on hospitals in statute. You'll see there, which raises revenue. You'll see below that there are spending items which reflect raising the rate to the federal upper payment limit, and the net at the top is the increase that the state gets in revenue after paying the hospitals the UPL rate. Below that is an item which is called Cap HMO Reserves. This language would return the language in statute on risk-based capital to the 2004 level. That was what was put in place in 2004. After that, there was the cap was taken off on how much capital could be accumulated by HMOs. This returns it to the 2004 level, and it causes the HMOs to set up a special account which they control that the excess would be put into, and they would spend that down against their MA contracts and create a savings for both the state and federal government. The numbers you see on here represent DHS's current best guess of what the state share of that would be. The feds would get an equal savings. And these numbers probably will get refined some as DHS does more work on it. Moving on, in the middle of page 5, we have the governor's PMAP Merck investment. This returns it to the level it was in 2010. Below that, we did not take the governor's rate increase for targeted service categories in MA. The last three items on page 5, that's lines 221 to the end of the page, are governor's items which save money. We took all of those. Moving on to page 6, we are taking the governor's 340B drug reimbursement program, and we are doing one of the governor's technology modernization projects. I should mention there are 3 listed under the governor's, one of which is related to the contingent appropriation spreadsheet I'll talk about at the end of this. The 2 others were in here. We're doing the one which is related to the exchange, but not the other one.
Representative Gruenhagen, I will add you to the list.
Yeah, that's my understanding.
Okay. Madam Chair, moving on, the next initiative says Reform 2020, and it's the governor's intensive services for children with autism. Even though it's under the Reform 2020 banner, this is actually not one of the original Reform 2020 proposals of the governor, so it appears here, not on the Reform 2020 supplemental sheet, but we do have that item. On line 461, the governor's item for transition initiatives for certain populations, you'll remember this is meant to help DHS transition people out of both the Security Hospital and Anoka Regional Treatment Center into community settings. We are keeping the language to do this, but we're going to start it in the next biennium because of cost reasons. We did not take the governor's nursing facility quality add-on on page line 475 since we upped the rate previously. We did take the last 2 items on page 6 are governor's savings items related to operating rate inflation and property rate inflation on nursing home facilities. Moving on to page 7, we on line 488 and 496, we did not take the governor's spending items on the home and community-based services performance initiative or the management improvement initiative. The next 2, the quality initiative, starting on line 501 and line 508, both relate to the first relates to the Mito settlement and training of staff in the use of restraints and isolation, appropriate use of restraints and isolation. The second item deals with training providers under the new 245D licensure, which appears later in the spreadsheet. We're doing both of these, but we did delay the effective date 1 year for cost purposes, so those will start in fiscal year 15. On lines 517 and 523 and 530 on page 7, those are governor's savings items, which we took just as the governor had them. Moving on to page 8, you'll see we did not take the 3 governor's spending items on lines 534, 540, and 547 relating to child care, the North Star Care Initiative, and the MFIP program. And we also did not take the parent outreach program on 565. The last 3 items on page 8, again, are governor's savings items that we do have in the bill, the EBT fee, the adoption caseload adjustment, and the supportive services expenditures match. On page 9, we did take the governor's expansion of the schooling grants program on 581. This is part of the mental health initiatives. We did take the governor's initiative on 587 to establish a clinical care coordination benefit in MA. And on 593, you'll see they're both zeros. We do have the language in to establish a family psychoeducational benefit in MA. It's not a cost item, but it does appear on the spreadsheet as a no cost while we expand that, and it is in the bill. We have the governor's item on line 597 to expand mental health crisis response services. The governor's item on 601 on adjusting the adult rehab mental health services payment rate. The governor's item on 607 on mental health specialty treatment services, which again you'll see is a zero cost item. It's changing the expenditure of dedicated revenues, but adds to zero on the sheet. We did not take the the health workforce substance abuse screening, which is really a training program for workers. That was a cost item we did not take on line 612. We are taking the governor's items on line 616 on the elimination of the alternative to Moose Lake grant. 620, the one-time reduction in the chemical dependency treatment fund carry forward authority. Moving on to page 10, we are taking the governor's initiative on line 626 on mental health transition services. Again, you'll see this as a shuffle of funds internally at DHS involving receipts and dedicated receipts in their specialty health care services. It adds to zero, but it changes the way it's financed internally. The next three items on lines 6.35, or well, 6.35 and 6.39 are both savings items related to changing the county share of payments for the Anoka Regional Treatment Center and the Minnesota Security Hospital. This mirrors changes that were made 2 years ago on the county share and costs in the sex offender program. And then on line 643, we took the governor's item to fund projected growth in the sex offender program. Moving down the page on line 648, we have the new fee schedule for the HCBS providers that we've talked about. Again, the ACA item on 653 is in, and also the ACA. 653, I think I said, for the HCBS, I think I said 653, but I meant 648. Moving down to 663, we did not take the two governor's items on child care licensing changes and the provider investigations and analytics. Moving on to page 11, on line 680, we took the item on expansion of internal audit capacity at DHS. Also on 685, the expansion of the surveillance and integrity review program through the Office of the OIG. On line 690, we took the governor's item to help increase MA provider recoveries. The 698 item on background study scope expanded. Do we include the language? Okay. I'm not sure if the language on the study scope is in or not. It is. Ms. Aves tells me that it's a no-cost item. And I believe the same is true of the background studies and access to MNSYS item as well. The language is in the bill. Moving on to line 708, the county performance management item the governor had. We did not take that spending item. On 714, we are doing the same, adjusting the transfers between the Healthcare Access Fund and the general fund. This has to do with cash flow, and the Healthcare Access Fund, we're doing that as well. At the bottom of page 11 on line 720, we have the item on strengthening newborn screening. This is related to the health department's newborn screening initiative, but this is the DHS piece of that. Moving on to page 12, on line 724, this is the ACA New Minnesota Care Initiative. There is in the bill language that has been developed between the governor's office and the legislative staff have tried to work through getting the language the same. DHS has costed it out and said it is, as far as they can tell in a quick analysis, looks the same as the governor's initiative, and so the cost items are the same, and that's the way we're carrying it at this point. The ACA administrative item on 739, we have the same as the governor, as well as the ACA Excuse me, we did shave one item on the ACA. The only change we made to ACA is on line 746, the ACA appeals item. There was some thought that the appeals would probably ramp up, and we don't really know how many appeals would happen, and so the number of appeals personnel at DHS was reduced in half in the first year and then straight lined out so that the legislature could get a gauge of how many appeals actually were happening under the new ACA and how many new staff might be needed. Line 751 is again the part of the ACA and Minnesota Care Exchange interface, the governor's item that we took. We also took the governor's mental health care in treatment in foster care item on 757, which saves money. The item on MA coverage of electronic tablets as communication devices on 761 also saves a small amount of money. On line 765 is the Wilmer Community-Based Health Hospital, which was scheduled to close. DHS and the governor agree that it should stay open now, and we have that item again. That nets to zero, but it anticipates that it will generate enough revenue in the state-operated services, especially healthcare area, to pay for itself. Moving on to page 13. At the top of the page on line 770 is an estimate for savings in the MFIP child care program based on the governor's all-day kindergarten initiative. I will say I've contacted DHS. The House may have a more robust all-day kindergarten initiative than the governor did, which might alter these numbers as the two bills move forward. On line 774 is the FAME program, which the governor restored, and we have as well. On line 778, we did not take the governor's homeless prevention program. However, Representative Clark's housing bill does have funding for several homeless and emergency homelessness and runaway youth programs that the base of the program is in DHS, but Representative Clark is funding some increase to the base in her bill. On line 784 is the repeal of the last 6 months of the 1.67% cut to long-term care providers. The item that is just below 791 on the unnumbered line is the governor funds part of his MA initiative and Minnesota Care initiative by transferring the cost of some MA populations to the Healthcare Access Fund, because under the new structure with more MA and a different Minnesota Care or BHP plan, the Healthcare Access Fund has lower costs and MA has higher costs. So the governor puts some of those costs onto the MA populations onto Healthcare Access. For the tails in this bill, we do more of that. We do the governor's and we do more of it in the tails. So it makes the Healthcare Access Fund, which has a substantial balance in 16 and 17, pay for part of the costs of MA populations in those years. On line 798, there's a transfer the governor did from the general fund to the Healthcare Access Fund for cash flow purposes. The House bill transfers it back to the general fund in fiscal 15. The Health Department is next on page 1115.
Mr. Berg, if we could, we were going to take it in parts. If we could, there were a couple people that had lined up for questions in the top portion before we go to the Department of Health. I'd like to get those answered if we could quickly. Representative Huntley, did you want to comment?
Just a comment. One thing we did not talk about is sex trafficking. And there, if I understand it's right, that's not in this bill. Representative Clark did put some housing in her bill. And my understanding from leadership is that Representative Hamar will put some of the police training to deal with sexual trafficking. I'm shaking my head there.
It's possible.
Possible, yeah. So we're working on that to normally this department, our this bill would not pay for training for police officers, so we're trying to get it there, and hopefully that will happen. This is, for me, a very important issue, and the cop training is very important. There is strong support for this particular measure dealing with sexual trafficking from the police departments around the state. They are really behind this, and this would help them start to deal with that.
I think Representative Huntley points out something that many of us have been watching, is that we heard lots of wonderful bills in this committee this year, things we felt very strongly about, but because we had such a horrible budget target, we've been blessed with other committees being willing to pick up some of the issues that normally we would have just included in this bill as appropriate. And so, as you mentioned, housing is one of them. I believe there's some bonding provisions that Representative Clark is working with Representative Hausman on for some bonding authority, too. So we'll see little bits and pieces of that bill and probably a few others showing up in some of the other bills, and we'll have to coordinate that and watch it carefully. I have Representative Abler and Gruenhagen on the list, and then if others, before we go to the Department of Health's portion, if you have questions or clarifications you need, you could ask them now. Representative Abler.
Well, I'll just ask. I'll defer to the end of the whole presentation. I'll just react to everything.
All right, Representative Gruenhagen.
Oh, thank you, Madam Chair. Chair Huntley, on page 5, there's that hospital surcharge. Are we going to discuss that further, or is this the only time to discuss the surcharge?
Well, we will
Representative
certainly
Huntley.
discuss it today. This is a very controversial issue, as we all know, and it's one of the big items that we did to adjust our deficit. And what this does is capture, again, federal money, which we use. The unfortunate and very controversial part of this section, and I'm not going to mince any words here, is that the hospitals get paid back for what they put into this. Unfortunately, they don't get paid back in the same way that they paid in. So some hospitals that have high medical assistance rates come out very well by doing this. Some hospitals that do not have high medical assistance rates are losers. So it is controversial. We have done this in the past, but I think members need to know that this is one where there's winners and losers.
And Representative Huntley, thank you for clarifying that. And I think we just mentioned to the committee, kind of lay out the week. We are going to be in this room or another room meeting for the whole week. We will be taking testimony and discussing the components, just as you're raising. There are some controversial components in here, and frankly, members may have different priorities that aren't reflected here that they'll want to talk about. So we'll be taking testimony from folks in the room and outside the room and hearing from members tomorrow and Thursday, and then Thursday amendments need to be completed by 10 a.m., and then Friday the bill will be open for amendment. And so we encourage you to be talking and thinking and listening and then preparing amendments for Friday. So that's how we're proceeding. Representative Gruenhagen.
Oh, thank you, Madam Chair. So is this the time to ask a few additional questions about this item?
I think if you want clarification, you could ask Representative Huntley. Otherwise, some of these questions, Representative Gruenhagen, may be asked of people testifying in the next few days, too, so you'll have that opportunity as well.
Okay, just one quick additional question, Madam Chair. Thank you for that input, and I'll try and make it brief. And then I have a couple other follow-up just questions on other items. Is there a sunset provision on that surcharge, Chair Huntley?
Representative Huntley.
No, there is not.
Okay.
Representative Gruenhagen, you had a couple other clarifications?
Yeah, just the next item there, cap HMO reserves. Mm-hmm. Is there a limit to their losses in a particular year?
Representative Huntley.
What this bill does is go back to the reserve corridor that we had from, I think, the mid-'80s up to about 2003. In 2004, the reserves were changed, and it allowed them to have much higher reserves. And I think that things worked very well up to 2003. And so what this bill does is say that they must reserve or reduce their reserves. And what they have to do with those reserves is help pay for, they have to spend down. Now, most of the HMOs, and this section just applies to HMOs, does not apply to the indemnity health insurance.
Yep.
Most of the HMO money, not all, but most of it is strictly from public programs. But what we're saying in here is, but some of the HMOs also have corporations that are buying their insurance through that. And what we're saying is when they keep these reserves, but what they have to do to get them down to where we would have had them in the 2003 time frame is they have to return that money to who's ever paying them. So if it's a private company, then the private company gets basically a reduction in their premiums. If it's MA or Minnesota Care, we're saying if that's where the money came from, that the HMOs must use that to pay MA or Minnesota Care rates.
And Representative Gruenhagen, if you've got a follow-up, we've got three other people too. So
Okay, real
continue
quickly. Thank you, Madam Chair. Chair Huntley, is there a limit to their losses in this bill at all? In other words, we're limiting their reserves. They're required by law to do this. What if they have an exceedingly bad year, a lot of overusage? Is there a limit to their losses on this?
There is, Madam Chair and Representative Gruenhagen, there is no limit to their losses. We are going back to what we had up to 2003, which said, I believe, that they had to have 3 months of potential expenses in their reserve account. Okay. So that's what we're going back to.
Representative Gruenhagen.
Hey, thank you, Madam Chair. Then on page 11, MA provider recoveries, is that Inspector Kerber's department?
Representative Huntley.
Madam Chair and Representative Gruenhagen, yes, that is Inspector General Gruenhagen's. Inspector General.
Thank you for the promotion. Without pay, by the way. No. So we're expanding that program, Madam Chair. Are we expanding that program?
Representative Huntley.
I'm looking for what line is that?
It's line 691.
Yeah,
on page
all
11.
we're doing there is this is what the governor proposed. And we're adapting what the governor has proposed, and this is savings that Mr. Kerber thinks they will get by going after fraud and abuse within the medical assistance program.
Yeah, and he's done.
Representative Gruenhagen, I think this book that we just handed out will help somewhat, and I also believe, staff's going to walk through some of this with you in just a few moments when we get through the overview.
One teeny little question yet, Madam Chair?
Oh, okay, Representative Gruenhagen. Just teeny. We're going to count.
You're very gracious, okay? There's been published reports, Chair Huntley, that the governor and Commissioner Jessen is taking a new approach to paying medical assistance that's supposed to save $90 million. Is that booked in this bill?
Representative Huntley.
I would refer to Mr. Berg.
Madam Chair, Representative Gruenhagen, I think when you say that, what you are referring to is in the governor's original budget, there was savings related to HMO contracts based on continuation of the bidding process, the open bidding process. Those savings were actually realized in the state budget in the February forecast. So the state's actually already booked the savings from that, and they no longer show up in the spreadsheet. I think that's what you're referring to.
I'm done, Madam Chair. I'll ask.
Thank you. We're glad you asked those questions. Representative Abler deferred, but he'd like to make his comments, and then I have Representative Mack and McDonald yet.
Well, thank you. And I was going to wait, but we got talking about stuff, so I think it's better to segment human services, and I think the Department of Health stuff is a little less controversial. And part of my questions are just a request for more discussion about some of the elements of this, independent of testimony. We're going to hear about some of these in testimony. And so over the course, maybe today if there's yet time to go back on some of these things, to look into the hospital surcharges and in some detail, what rate was it, and eventually there'll be a run on the winners and losers. And I understand the challenge Representative Huntley had to make this budget work, and I'm sympathetic. I'm not happy with all the choices he made, frankly, but we'll talk about those. And I'm happy that DD providers are not so unhappy with their thing. On the nursing home rates, I'd like a similar discussion about that. It looks like we took the governor's reduction of property rates and gave back a portion of that in a COLA. I'd like some detail about that as we go on. On the HMOs, where we cap their rates, and I'm not disagreeable about that. I looked into that in 2011, and for some reason I was talked out of it. It is one-time money, and so it puts a burden on the tails. And it may or may be problematic, but I'm just curious about the run on that, and I'm sure there'll be testimony from multiple groups on that one. They may all come on their own on that one. And the MCO trend caps, I would like to talk about that more later. That's on page 3. I think those are existing contracts, and there's some additional savings that's being squeezed out of there, which is Representative Gruenhagen's question, I think. We have $21 million. I'm also extremely interested and worried about the rate-setting piece of the bill, which I don't know what the current language is, and the licensing. These are really important, necessary things to do, but they can be done well and they can be done unwell. I hope that this committee will choose to push the department to err on the side of the provider so they can stay open. Their opening offer was 5% reduction, plus or minus, in the first year. That was last year's bill, I think. They've realized that was a terrible idea, and they're back to, I think, 1%. And so that'll be some discussion now, hopefully, with Representative Norton and I. We can come to an agreement before we get to the markup. But they are grievously at risk, the providers are, with some of these changes. If we do it badly, if like the department wants and do it right away, we will see places closing that were really well run, and we don't want that. So I'd like to talk about that. And Representative Huntley, I'm surprised you went after the Healthcare Access Fund for $460 million to pay for the medical assistance expansion that we all thought was so great. And we can talk about that. Do you want to react to that, Mr. Representative Huntley?
Well, I've been a very strong, Madam Chair, and Representative Abel, a very strong supporter of protecting the Healthcare Access Fund and not using it in general for general fund expenses. But what we're talking about with this bill is the same people that are currently either on Minnesota Care or eligible for Minnesota Care. And some of that group will be in medical assistance, and I don't mind using Healthcare Access Fund to pay for the same people we're already paying for on Minnesota Care. And so if they've shifted to MA, at least the feds are going to pay half, and we'll only have to pay half. So I think it's basically the same group of people. So I'm not opposed to that transfer. If you wanted me to take Healthcare Access Fund to pay for somebody that's at 75% of poverty, I would not support that.
Thanks, Madam Chair.
Representative.
I know your feelings about that, and we can discuss that more. I just thought it was a big bite. The governor didn't do it, and so maybe you thought of something they didn't, but that'll certainly be interesting to a lot of the people. So we can discuss it more. Was surprised to see that. There was ongoing concern about the 340B drug charge changes. And I was absent that day in testimony, but I've heard quite a bit from the pharmacies about some of that. And we keep nicking away at what we pay for pharmacy, and we're not going to have any Minnesota-based Medicaid pharmacies pretty soon. So I'm just expressing my concern about that. And I think that we probably shouldn't do that somehow or other. And I just have two more, but I thought I'd give you the list. And so,
continue, Representative.
Thanks. And Mr. Chair, I hope that the reduction of teen challenge wasn't anything except a monetary choice. We agreed on that on a bipartisan basis last year. That is one of the most effective programs to take kids at the end of the at the end of the pipeline, one person there has been through 19 drug times. But we spent happily out of our chemical dependency fund, and we would pay more. And some of these kids actually get done. So I hope there's a way to replenish that, because that is, there is a spiritual piece to that, but they absolutely get better. They have I won't discuss that now, but I think they'll be pretty surprised about that.
And Representative Huntley, I don't believe it's just not increasing it. It's not. As I understand that, Representative Huntley?
Madam Chair, it's stopping the increase, and I think I was the one that had the bill that got him the increase, so this is one of the painful ones for Tom Huntley that I put in there.
Yeah, so it's not cut to the base.
And I would also say on the 340B thing that there's like 100 different groups that interact with the state with the 340B program, and each one has an individual contract that is different, and it's a very difficult mess for the department to have to deal with that, and I do certainly believe that we need some reform of the 340B system, so it's at least much easier to administer, and that all the groups that are getting money through it get basically the same treatment.
Thanks.
Representative Abler?
And Madam Chair, Representative Huntley, I'll continue to work with you on the process here. I just hope to everything that the governor doesn't accept your target, and that some of these choices that are merely math choices can be dealt with in a different way. And the last thing, which I think is something you want to consider looking at as well, is I support the family cap repeal, but I think taking away the job supports might be not the way to get the money, even though it's TANF. And at some point, I'd like to hear from my own job, Anoka County's job, really good job center, and see if this is going to undo what they can do to get people actually working. So, Madam Chair, there's a lot of more discussion to have. I thought I would be productive for the chair and members to know where my highlighted concerns are, and I'm committed to be part of this process to get a bill that works. And but I want to also point out that a lot of the things that we did in 2011 have not been undone. And the rate improvement on that one area, we didn't want to cut that rate anyway. That we didn't know it would be done so ham-handedly as to cause some of the harm that happened there. That low needs thing, and who knew that the mental health was so underrepresented in the tools they were using, and so that was an unintended consequence. And the 1.67% rate cut was supposed to be long fixed by now, with the waiver that was almost sure to come, and so I appreciate Representative fixing those two clinkers. But I'm also happy that a lot of the reforms that were done in 2011 are left intact by the governor and the House, because they were solid, good reforms that were provoked by people digging in and finding new ways to do services. So maybe we can do some of that same thing in this bill, Madam Chair. Thank you.
Thank you, Representative Abler, and I hope we can have that kind of bipartisan support for whatever we come out with this year. Representative Mack, and then Representative McDonald.
Thank you, Madam Chair. I've actually had time to kind of find the answer to my question, and it was just with some details about the surcharge, Chair Huntley. And so if anyone's looking, it's on 151 of the bill. But it explains that the increase will go to 2.63% of revenues from hospitals. And then I found that the payback will be 30%. Is that accurate to hospitals? What they'll see? And so I guess my question to Representative Huntley is it your, and I'm sure we'll hear from testifiers, will that make, I'm just trying to figure this out, will that make the hospital community whole at the end of the day? And then my follow-up question to that is, and I was trying to just do a little research on the history of the surcharge, is there a place that the department has on what that surcharge is specifically used for, how that money has been used in the past? Is there a way for committee members to know that?
Representative Huntley.
Madam Chair, I would refer to Mr. Berg to give the precise number that has gone up, and So, Mr. Berg, if you would.
Mr. Berg.
Madam Chair, Representative Mack, I think if I would correct one thing, then there are going to be a substantial number of revisions that we just got the bill this morning, and so there are going to be a substantial number of errors and revisions in author's amendment on Friday. I believe, I didn't bring my sheet down, but I believe the correct number for the cap is actually to 2.68% is the number that will appear in statute rather than the one that's in the draft right now. The upper payment limit, the rate under MA that gets increased is 30%, and that's the information that I have from the department on how much we can increase the MA rate to get to the maximum limit you can go to under federal law, which changes from year to year. There's a thing called the upper payment limit, the UPL. This bill anticipates we up the surcharge, then we up the rate to the federal maximum. That doesn't pay every hospital back individually the amount they would put into the surcharge. It varies greatly based on how much their MA business is. The surcharge is based on their total book of business, but the payback is based on an increase on the rate on their MA business. So no, individual hospitals won't get paid back all of their money.
Representative Mack, as someone who represents the Mayo Clinic down in Rochester, we are very concerned about this provision because they are one of those that will be inordinately affected, and I'm hearing that there will be a few others that, and I think we'll hear that in the next few days.
Sure,
and
Madam Chair.
Representative Huntley wanted to finish, I think, answering, and then we'll get back to your question. Representative Huntley?
I would certainly agree with the chair that the Mayo Clinic gets a big hit on this, and they bring in people in from all over the country, and they have to pay for that, even though they're not Minnesota residents that they're treating. So that is a controversial issue. And Mr. Berg, but am I correct that basically 100% of what the surcharge raises from the hospital will go back to some hospital? It might not be the one that paid the amount, but the dollar amount.
Mr. Berg?
Madam Chair, no. I mean, we are, there is a revenue raising for the state that helps us make our balance in this bill. I mean, there is a net benefit to the state, if you want to look at it that way.
But
Representative Huntley.
Madam Chair and Mr. Berg, but doesn't most of that net revenue to the state come from the federal contribution?
Mr. Berg.
Mr. Chair, no, I don't believe that's the case. This will raise a surcharge on the hospital's book of business. We will raise the maximum payment rate to the hospitals under MA to a 30% increase. Under the maximum payment, the state will have to pay a certain amount, and the feds will pay an equal amount, and it is not quite, just one moment, Madam Chair, it would be 55.98. Madam Chair, Representative Huntley, it's not quite a full payback. It gets close, but it's not quite a full payback with the federal side in it.
And Representative Mack, did you want to?
Maybe just a clarifying question to that point. To Mr. Berg, if I understand the upper payment limit, does that mean that if we up to 30% payback to the hospitals, will that be matched dollar for dollar by the federal government in MA funds? And so we're just going to the point at which it's a dollar for dollar match. If we were to go higher than that, then the state's putting in more than what the feds would match. Am I understanding what you're saying on that particular point, why 30% is the chosen number there?
Madam Chair, Representative Mack, the upper payment limit is a limit established in federal law on how high the rate can be. We cannot exceed that under federal law. So of the rate increase under most circumstances, the feds pay half and we pay half. That's what would happen in the rate increase. There are some places where the split is different, but generally that's what would happen. But we can't exceed the cap.
Okay.
Yeah.
And
Representative Mack?
thank you, Madam Chair. And just one last comment, I guess. My initial impression, and so maybe clarity over the next couple of days, was what Representative Huntley was originally speaking to, was that at the end of the day, there would be winners and losers in the hospital community, but the community as a whole would be made whole. At the end of the day, what was paid in would be redistributed in full back. So if there's any clarity available in terms of what that discrepancy will be, or maybe testifiers, and if there's a way, if it's maybe Representative Huntley's goal, or was his goal in drafting this, to remedy that, be very interested to know if that's even possible and still fall under the federal guidelines and everything else. Thank you, Madam
Looks
Chair.
like Mr. Berg has another clarification.
Madam Chair, it looks to me in very quick calculation that if you add the federal side on to what our payback is in the first year, the revenue would exceed the total payback by about $6 million. Part of the problem is that in at least one case, if you look at it, the adults without kids, you see there's not a payback number in 2015. That's because we actually, under the calculation, we hit the upper payment limit in 2014, and we can't go any higher the next year there. So we can't pay them back the additional money in the next year on that one. So it gets close to it with the federal money, but not quite all the way.
Okay. Thank you, Madam Chair.
Thank you. Representative McDonald, and then Gruenhagen.
Madam Chair, thank you. I was just wondering if Chair Huntley would consider extending the deadline. You said, Thursday at 10 a.m.? Thought with the scope of the bill and some of the other committees that we're on that are doing the same thing, that maybe several hours, maybe later in the afternoon, if you'd be willing to extend that deadline for our amendments.
Representative Huntley's been pretty firm on this up to now. Representative Huntley?
Madam Chair and Representative McDonald, I would like to have them in on time. It's a very complicated issue, and I would also say that if you were submitting amendments that cost money, you better have in the amendment something that says where the money's coming from, or it will be rolled out of order.
Thank you. And we do have 2 days, so we need to keep this bill in front of us and do some reading, I think, between now and Thursday morning at 10 a.m.
Madam Chair.
Representative Huntley.
If I could just, one of the things, and I don't like the hospital surcharge. It's something I think that I have to do, or we have to do. But you need to look at this in the perspective of everything else that's going on. And with the medical assistance expansion that we're talking about, there's about 1.7 additional billion dollars from the feds coming in this biennium, 2.4 billion in the next biennium to our healthcare providers. In the first biennium, about 300 million of that is going to hospitals. And in fact, the numbers we've gotten from the Department of Health, that the uncompensated care that hospitals currently must pay for, or somebody pays for, should be reduced because of what we're doing by about 170 million. So there are other things going on with hospitals at the same time. Some of them are very good, and this particular one for some hospitals is not so good.
And Representative Huntley, we're going to take one more one more question from members, and then we're going to let Mr. Berg go through the Department of Health, and then we'll come back at 2:15, just as a heads up. I did just want to say the point that you just made, Representative Huntley, about there are other aspects of the bill with the growth of MA, still only helps hospitals that have patients in MA. So we may be negatively affecting, again, the same hospitals twice with both of those actions. So we'll just have to watch that as we move ahead. And so Representative Gruenhagen quickly, and then we're going to do the Department of Health portion.
My understanding is if the state payback, if they take $100 million out of the hospitals through this tax or whatever they take back, if they pay back 50%, then with the 50% match from the feds, it should be made whole. But I mean, it's unequal to the different hospitals. And my understanding is that we're at a 50% payout, or is that incorrect, Mr. Burke?
Mr. Burke.
Madam Chair, Representative Gruenhagen, yeah, that's basically right. I was just saying, in the case of MA, usually it's 50-50. There are some cases where it's not, but here. And you're right that the issue is primarily, but not exclusively, who gets what in this. Different hospitals will pay, and different hospitals will get different amounts back. But also, the total payback doesn't quite equal what would be the revenue, because there are problems where we bump into the upper payment limit and we can't legally pay back that much. So that's part of it. So not 100% of it gets paid back, and it definitely does not get paid back to the same people who generate it.
Okay.
Members, if you turn to page 13 of 18 on your form, the Department of Health portion is there. And I don't think anyone, I'm just trying to move along so we can get this through. There will be lots of time for discussion in the next days, so please be thinking, and we'll get your names on the list and all your questions answered as well as testimony. So I hope you aren't feeling too terribly rushed today, because we've got time ahead. Mr. Burke.
Madam Chair, the Health Department and the boards will go quickly. Just one note on a slight correction. Representative Abler had made reference to the shifting of MA populations to healthcare access and said the governor doesn't do this. The governor actually does quite a bit of it in his Minnesota Care initiative. We just do more of it in the tails. So it is there is shifting of MA populations to healthcare access in the governor's initiative on the top of page 12.
Thank you.
Moving to the bottom of page 13, the Health Department, the first set of items, increased core public health activities, is the governor's general fund initiative. The House took that in total. Below that is an item called MERC, which is an addition out of the Healthcare Access Fund that is funding replacing a carve-out of additional MERC funds in statute that was repealed 2 years ago, I believe. There's some discussion at the staff of whether I think there's language now transferring this to the MERC fund in statute. We weren't exactly sure whether to carry this at the Health Department or in the DHS portion, but for now it's in health, and there is transfer language in the bill that allows the money to get transferred to the MERC fund. At the top of page 14, there are just a few additional things at health that are different from the governor. The first item on 14, the nurse staffing study, this is Representative Atkins' bill, which at this point is a study of nurse staffing levels. And this bill contains the cost of that study. The next three items, this is the base adjustment. This is analogous to the base adjustment at DHS. It's carried in three items just on the three separate funds here, because I had a spreadsheet issue when I put it in and had to do it as three items rather than one, but it's the same thing that you saw at DHS. It represents 1% each year of the salary base of each of the lines that are represented in each of the funds that are represented. And other than that, there are no changes at the Health Department. The spreadsheet runs on to a number of pages of stuff that are not in this committee's purview at the Health Department that are over in the Environment Committee. And just to finish up quickly, moving to page 16, where the health-related boards start, you will see in each of the boards a small increase in the state government special revenue fund. These again represent the 1% each year based on their salary base in the state government special revenue fund. On page 17, the only change other than that at the boards is on line 1262. Representative Huntley has a bill which last year we did a study of ambulance uncompensated care. which was run through the Board of Nursing Home Administrators. It was a $10,000 one-time item. The bill didn't contain language saying it was one time, so it was booked in the State General Fund as a permanent item. Representative Huntley's bill just clarifies last year's bill to say it's one time, so you see we have a $20,000 savings from just changing the last year's statute to clarify that. Again, the rest of page 17 and going on to page 18 are the 1% increase on the board's base. That carries over into the Emergency Medical Services Board and the Ombudsman for Mental Health in the general fund. Those are the 1% base increase based on their salary. The same is true with the Ombudsman for Families and the Disability Council, and then members will remember that the governor had very small initiatives at a staff position at the Ombudsman for Families and an emergency preparedness item at the Disability Council that are covered. And that's the main spreadsheet. And Madam Chair, I can just very briefly, there is a supplemental spreadsheet that members have that is letter-sized. It is titled, in the upper right-hand corner, it is titled 2013 HHS Tracking, House File 1233, 2020 Supplemental. And what this does is it takes the entire governor's 2020 reform initiative and pulls it out of the main spreadsheet and puts it into a contingent funding article. All of this, you'll remember, was contingent on our receiving a waiver from the federal government, both the changes in spending, the savings and the changes in spending. This pulls it all out and puts it in separately. If you look at the top, you'll notice that it has zero net fiscal impact. Whether we spend the money as it is in the main funding article or it gets triggered in the contingent article, the amount of spending is identical, so the contingent spending doesn't add any new spending. It just would change where some things happen. There are savings in the out years. If the contingency is activated, it does save almost $60 million in the out years, but that is only in the event that we get the waiver. Other than that, this sheet, the items for 2020 are exactly as they appeared in the governor's budget. They're just pulled out to make it clear they're totally contingent.
And Mr. Berg, might I ask, and I don't know if this question could go to Representative Huntley, or if you know the answer, when do they anticipate getting a response? Was there a deadline?
Madam Chair, there just usually is not an answer to that with federal waivers. We can ask the department, but I've never found that there's any kind of timeline that you can count on with.
There's usually a deadline to have the application in, but when they actually release the money is open-ended. Okay.
That's correct, Madam
Thank
Chair.
you. Representative Huntley, how would you like to proceed at this point? Are there questions anyone has on the Department of Health? Maybe we should go to that first. Representative Abler?
Thanks. And you said we're coming back at 2:15?
2:15.
For more of this discussion.
For more fun in Health and Human Services.
Exactly. This is like fun.
And I've just instructed Representative Abler that the staff will walk through the language for us.
Oh, thank you.
Of the actual bill.
That'll be very good.
Okay.
Just a comment about actually the base adjustment. We talked about this in Ways and Means and how you're going to pay for the increases of the contracts that we've been ratifying. So I think it's a reasonable thing to acknowledge that. Otherwise, what we're saying is that the departments have to, again, manage within the appropriation and give raises, so I have to leave vacancies open. So I think that's a productive thing. I have a question for Representative Huntley. On the board allowances, we did the 1%. You did. This is actually still you did this, but anyway, the Huntley bill. But you provided 1% to the boards for their salary packages. The EMSRB, as the exception, wanted some money from the general fund, which is problematic, just given your target. But the rest of the boards had a request for some appropriation increases for varying worthy projects. And I have a bill about that. Are you open to that, entertaining that? It'd be special revenue fund with no general fund impact. Is that something I should pursue?
Madam Chair and Representative Abler, I'm certainly happy to discuss that with you. I'm obviously most interested in the general fund, and the special revenue funds should be designed to cover the cost of operating that board. That's the only thing I would say. And if we want them to do something extra, then we should pay for it.
Thank you, Matt. Thank you, Mr. Chair.
Or I shouldn't say we should pay for it.
Yeah, they should.
Or the people that get licensed would have to pay for it.
Thank you, Madam Chair.
Thank you, Representative Huntley. Right now, I think we're gonna pause. I need someone that has looked over the minutes to move them for me. I have two sets of minutes, one for April 5th and one for April 4th. Has anyone had an opportunity to look at those and would be willing to move them, please?
Madam Chair, I'll move the minutes.
Thank you. Representative Schumacher moves the minutes of April 4th and April 5th.
Yes, Madam Chair.
Anyone have any questions about either of those? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? We've approved the minutes. Members, just as a reminder, we're recessing now until 2:15 in room 5. All right, 2:15 in room 5. We'll see you then. We're into recess.
All righty.